is, here we go, starting to record. This is our section 1 mid-adult group session recording for module 5. I'm Christy and Michelle here are present with me, and we'll go ahead and start our session now.
Good afternoon, everybody. I'm just going to go over the minutes from last time and our roles for this time. So this time I am the leader and Jose is the scribe, is our scribe and our minute keeper, and Christy is our facilitator. Last time we went over discussing the middle class, that we were going to ultimately decide that we were going to focus on the middle class. Decided our 5 patterns that we were going to focus on, which was health perception and management, activity, cognitive, coping stress, and values and beliefs that we were going to focus on, and using the 5 A's as our tool. We did discuss the limitations of the 5 A's, that it didn't have a scoring ability or scale to let us know how high risk each patient was, and then discussed our timeline for our assignment due and when we were going to meet the next time. And that's it.
Okay. Nice. Thank you, Michelle.
So I have posted my article up onto our discussion board, and I chose the economic evaluations of tobacco control mass media campaign. So that's up there for you guys to take a look at when you're ready.
Okay. I also posted a article on our discussion board. I know for our article for this particular module, there was a little bit of a, I believe, a choice between a health promotion aspect to it or a presentation for a funding article that we could find, and I know that that's one that Michelle had was able to find, and I'll let her discuss in a little bit. So I was trying to follow her lead in that, and I just really couldn't find anything that I found. A lot of stuff, of course, with articles about about a specific presentation or a specific funding research presentation, but nothing that I could really grasp about, like maybe like aspects about a presentation or characteristics of a good presentation type of thing. So I went back with a health promotion one, and I found one about I know my last one was about a group support intervention. This one was a little bit different take on it. It was like a open, like a rolling group support model. My last one was about an online group support. This one is like almost like a Alcoholics Anonymous model, where people can just drop in as they can. And so that was kind of what my article was about for this week.
See, I had a hard time because, oh, sorry.
Go ahead, Chrissy.
Oh, I kind of had a hard time trying to find something, because I think I was doing more like health promotion for smoking cessation. So I was getting all kinds of wacky stuff. I liked Michelle's article that she posted, and I had already, started my annotated bibliography, and I was like, oh shoot. But so I'm hoping that the mass media campaigns and asking for funding and how much it costs, and hopefully that will definitely help us out.
Okay.
It actually took me a long time to find this article, because you got a lot of schools about how to do healthcare projects and healthcare promotion and how to do projects in general, like project management. So I really lucked out with this one. It is good because it discusses some of the reasons why projects fail and what makes them succeed, which is a lot of leadership support. But also the reason why they tend to lag on is because, and this is really real life, is because you're doing projects in conjunction with your own regular work. Like when you're on the floor and you're dealing with patients, and then somewhere in between you're doing the projects, which is really hard. So I thought it was actually a good article for it.
Yeah, it really was. I think it'll end up helping our own project a lot more.
Yep.
Okay, so we can move on, I guess, to our biggest project is our project is the PowerPoint presentation, and I think that if I don't know, I mean, do you guys want to simply go down the list and kind of I mean, there's 20 slides and there's 20 bullet points, it looks like, on the suggested arrangement that we have at our disposal here. I don't know if you guys saw it, and I think I don't know if this is what you were talking about, Christy, but I guess we could just kind of simply just, just go over them really quick and just kind of talk a little bit about them, get our thoughts, and then kind of move forward. I don't want to, set forth our whole project right now, but I guess this is going to be a good leeway into the rest of the week for us. What do you guys think?
Yep.
Yeah, I think that's good. That way we're just on the same page with, some of the major things that we haven't discussed yet. So that's a good idea.
All right. I think the slides 1, 2, 3, I can, on the title page name of the project, I think Christy already has actually prepared that for us. Thank you, Christy. And then we all inserted our stuff for slide 2. Number 3, I think that we have our health promotion definition on our Google Docs, and if you guys want, I can just translate that onto there. If it's not incorrect, but I think we were kind of thinking, we got a little bit, I think Michelle and I thought we were missing a little something, I'm not sure, because we were trying to integrate all of ours into that one. Right. And so, I don't know, I guess maybe we can kind of at least, let's nail that down, at least maybe today, and then, I can transfer it into that slide number 3.
Okay.
And then we can kind of move forward. So let's get some of these guys churned out. We've already talked about, what do you guys think? I'm sorry, I don't mean to hoard all this. I just want to try to move it along. I know that Christy has a meeting coming up.
No, that sounds good. We can just fine tune it, and then you can just copy and paste it onto the slide. So, because I think it is for the most part done.
Right. What do you think, Christy? Yeah?
Yep, sounds good.
Okay.
We've got our target population.
Don't hesitate to tell me to shut up and if you guys want to say something. Our target population, I think we already agreed we're doing middle class, yeah?
Yep. Middle class. Middle class folks that pertain to our DRHA scenario, right? Did I understand correctly? Okay. So the middle class folk that are hanging behind the cafe, smoking and such, yeah? Yep.
Yep.
I was going to say something else. But
I know you were. I started laughing.
So, and then, of course, then describing the DRHA scenario. I can even do that also if you guys want. We're just simply summarizing, right? And we're not gonna. I'm not gonna do word by word, but kind of get the gist of what the heck's going on back there, right?
Okay.
Okay. And then, so describe the identified health deficits that pertain to our population. This should come from your readings, your health assessment. This is where your data collection and your research comes in. What have you learned about your population's health deficits? What does the literature say? So I guess this is something that we should kind of at least discuss a little bit about concerning health deficits. So what do you guys think? What are you guys' thoughts?
So would that even be things that they're at risk for, like coronary artery disease or like cardiovascular disease? Would that include that?
I was thinking, I mean, absolutely, but I'm wondering, or like any of the lung cancer stuff that we had previously spoken
Right.
of, but I'm wondering if that I'm not sure if deficits translates to risks.
Yeah, that's what I'm wondering.
But there's something to think about too. I think one of the things that we're talking about the cancer and the coronary artery disease, but we also maybe want to think about other health risks as far as like for women, especially with the preterm labor, low birth weights. I don't know if we're kind of getting out of that, or that would be, like you said, the risk of.
So I guess we should maybe determine, I guess, right? That's the correct word. Whether if by deficit it means risks, right? Because then we can say, oh yeah, blah, 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 all this other stuff.
Right.
But if maybe deficits means something else, like I'm not sure, but I'm wondering like that coping inadequate coping or inadequate stress coping type of stuff where it leads you to smoking, maybe I'm just kind of spitballing here, but I'm wondering if that is our deficit. So maybe kind of go back to our readings and maybe even post a question as if by deficits mean risks, or kind of like whatever predisposed stuff is going on that makes them kind of smoke, right? Like maybe, I don't know. There's a genetic factor, more like if people at home are smoking, right? If mom and pops has been smoking your whole life, then maybe that's kind of like what you do. So I can, if you guys want, I'll look into the reading if you guys want, and then kind of see if there's something that says deficits is this, then I can convey that. Otherwise, I can ask a question if you guys, what do you guys think?
Yeah, so I do wonder if Jose's right and they just mean general health deficits of that entire like age population, or yeah, I understand what you're saying.
Yeah.
I just can't think of any.
No, I mean, we could simply go by that stuff, like the coping and the, being around it, or I'm not sure the culturally or ethnically, there's some folks who might be a little bit more predisposed to smoking than others. So, all right, so let's kind of put that one on a back burner, and we'll kind of determine, I guess, at least, and then I can convey like, oh no, we're way off. It means whatever.
Okay.
Okay. All right. So the next one has to do with determine our proposed intervention. So our proposed intervention is the 5 A's.
Yes.
Right?
Yes.
Okay. All right.
So, I'm thinking that the intervention would be more like exercise programs, pharmacological, that kind. Because I think the next one is at the theoretical. Let's see, we did the theoretical model, and then we put the 5 stages. I think the interventions wouldn't be in the 5A is not a proposed intervention. I'm thinking it's more exercise, medication-based, counseling.
Huh. Now I'm kind of low because I thought like our theoretical framework was that social cognitive one that we had spoken about, right?
Yeah, it was the I always want to say trans-ischemic, but that's
Trans-theoretical.
Right.
yeah,
Yes,
trans-theoretical.
trans-theoretical is the one that we chose. And so I guess I was under the impression that the intervention proposal was a 5.
That is what I thought too, because when it says based on existing knowledge, theory, and evidence, like we have studies about the evidence that this works, but I don't know how to do the existing knowledge, theory, and evidence of the like specific interventions that.
Because the 5As would be more of an assessment tool. Because you're asking.
Well, I'm thinking that you're right. It is our assessment tool. I mean, because that's what we had it, right, as an assessment tool. But isn't that what I'm wondering if isn't that what our intervention is? Because we're trying to determine risk, folks who are at risk, whatever, and then, here, this is what we're going to do about it because we're going to help you go through a plan, and then we're going to not only we're going to help you establish a plan, but then we're going to, follow up with, with whatever, like, hey, how have you been doing with it or whatever. I think that this is kind of, we really need to nail this down for sure because, I feel like this is kind of like the whole thing, right? This is the whole idea of the PowerPoint is to get your intervention. So you're saying, Christy, is that our intervention could be using the 5A's assessment tool, we can propose, nicotine patch with physical activity program.
Yes.
Yeah, so do you think we could integrate it then? Like,
yeah.
Because we have to put the 5A's in there somewhere, but if we just like say we use that to suggest or propose like an exercise routine or improving diet or nicotine patches.
But I almost feel that falls into your plan aspect of the 5A's, right? Like part of the plan is how in the hell are you going to do this, right? Okay, let's put you on a damn pharmacological therapy and come on, let's, eat better, exercise more, sleep better, blah, blah. So I almost feel like that falls into the plan aspect of the 5A's, but maybe, I don't know. Now I'm like, my whole mind's blown and I don't know now, but I kind of feel like we can integrate whatever, the stuff that you're talking about, Christy, into that 5A's as part of the plan, right? Because the plans are, you don't just say, just stop smoking, man, and just buck up. You say, okay, this is what we're going to do. You're going to blah, blah, blah. And that's, I think, I mean, I don't know if that makes any sense.
Yeah, I think I think we can integrate them. And my only question is, because we have to put the 5A's in there somewhere, and is there a better spot to put it? But if not, then we could integrate it here.
I'm thinking that because the next slide would be
I feel like slide 8 is a trans-theoretical one.
Right.
So, but on 8, we can also put the 5A's, and then we could also put our 5 stages. I mean, our patterns.
and guide to intervention.
Let me see here.
Because I want to say we really haven't said or used physical activity or nicotine in like as our intervention or anything. I think we've been using the 5 A's. If I'm right, have we been saying our 5 A's is going to be our intervention?
Yeah, I think so. I mean, that's how I understood it, but.
I'm just looking something up real quick.
Okay.
You know what? The 5 A's, we can do it like you have. So we're asked the advising. The advising is where we can put in our recommendations. Would be the exercise. So so ask, advise, assess, assist, and arrange. So on the advise, we can put we advise to participate in the exercise program. We advise to see your healthcare provider for pharmacological. So that's where that can all go.
Right. And I'm so sorry. That's in my head. Plan was the advice part. I'm so sorry. And I'm telling you, this is the way I freaking think. In my head, what I was just talking about, the plan, and we can work that stuff into the plan, was the advise aspect of the AAA. So yeah, absolutely, we can throw that stuff in there.
Okay.
What do you guys think? So just to kind of, are you okay, Chrissy, if we and it's not simply like, are you okay, Chrissy? It really is like defines our whole project, so we have to make sure that we're going about it the right way. But
I'm gonna send you guys a web link
okay.
that I found, and it will break it all down.
Okay. All right.
So, and I just want to clarify, we're still talking about slide 7.
Yes.
Okay, I just want to make, because we started on slide 8 and then we kind of backtracked. So I just want to make sure, like, I'm still understanding. Like, I got confused.
Yeah, well, because in the 5 A's, it talks about ask, and then the other A, what is it? Assess?
Right.
And then advise, arrange, and then.
So it's ask, advise, assess, assist, arrange.
Mm-hmm.
Assist and arrange. Okay. So in the advise, even assist and even arrange aspect of it, I know that there's clear delineations for each stuff, but we can, advise you to, look it up with some physical activity and, just, eat better and nicotine and all this other stuff. So that's what we were talking, Michelle, is trying to integrate that. What Christy was talking about is the specific physical activity stuff into the AAA stuff, but under the advice aspect of it.
Right.
Okay. And then Christy is going to send us a link to kind of further clarify a little bit. So are we all kind of on the same page as to how we can kind of do slide 7?
No, I think that's good.
And I feel like this is where a big portion of our referencing, presenting evidence is it sounds like this is where we're gonna have a lot of that stuff, right? Because and even the next slide and slide 9, so 7, 8, and 9 is where we're gonna be like, here, this is kind of like what we're going to try and do with this population, right?
Right.
Mm-hmm.
Okay. So we've already kind of discussed a little bit about slide 8, is that we're going to use a trans-theoretical as our theoretical framework that will support and guide your intervention. Why in the hell did we select this guide? And I think that we all kind of felt like it really correlated a lot with the smoking cessation stuff. So if you, I can throw some stuff in there because I feel like some of the stuff that is just kind of like the summarization aspect of it. You know, like today I can, you know, put some of this stuff, start inserting some of the summarization stuff after so we can have stuff and we can kind of base everybody's input like adding to it. So I'll kind of describe the theoretical framework and then everybody, you know, if you guys want to start adding stuff as to like, if you see that, oh, Jose, you didn't put Y, then we can throw something on there. What do you guys think?
Yeah, the one thing that hold on, I didn't put Michelle's address in there, right? The one thing that we need to try to make sure is that, are you guys there?
Yes,
Yeah.
I'm listening. I hear you.
Oh,
Yeah.
okay, I can't see you guys. Let me see. I'm here. I just need to get my camera back.
Okay.
There we go. Okay. The one thing that we need to try to avoid is making it super busy.
Right.
So I think where the most of it, you know, we're just going to put our points on it, and then what we'll do is in our, you know, in our recording, that's where all of the detailed information is going to go. I don't want to try to shove it all onto the slides.
Right.
Right. Because on the bottom of each slide is the notes, which I think will put the more detailed,
Yeah.
the more
Right.
detailed aspects that go with each bullet point.
Yep, you got it. You got it. Yeah, that's the thing is like I think she or our instructions are to succinctly put stuff in there, bulleted, summarize stuff, and then the majority of your and what I'm thinking we're going to go off of when we're talking about it is our nursing PowerPoint notes, right?
Yep.
Yeah.
All right. So I'll, you know, just do a super light, succinct summary of our trans-theoretical framework, and then we can add, you know, why and some of this stuff on there. Are you guys okay with that?
Mm-hmm.
Okay. Slide 9, describe the method, materials, and procedures for implementing the intervention. Remember, you only have 20 grand. So is this the part where we actually are allocating funds for developing of this, like we're going to hold a all-day clinic where we have, you know, like where we have people out there outside of our DRHA facility trying to.
Actually, that's not a bad idea. Like having like a little like health fair thing out there,
Yeah.
where we do like blood pressures and stuff,
Mm-hmm.
Yeah, I love
and
that
talk
health.
to them. That's a good idea.
I mean, if that's kind of like how we would then, you know, try to get this, the methodology anyways of this, and you know, you got to pay someone, you got to make up, right, some sort of pamphlet or some sort of dissemination of information brochure maybe, or just some informative stuff while you have to pay a couple, 2, 3, 4, 5, 10 nurses, just kidding, not that many, but you know, to do these little quick assessments and determine, yeah, this guy is really kind of wanting to quit, let's, you know, try to help him out. So that's just an initial idea. I mean, what do you think, Christy?
Yep, I think that sounds good.
Yeah.
And we may
Definitely,
not
since
even have to. Oh, go ahead.
I was just going to say, especially since we are, you know, definitely educators, so getting as many nurses involved so that we can, you know, trickle it down. I think that's a good idea.
So in this slide, do we have to actually develop like a business plan and determine allocate what goes where? Like $5,000 is going to go for this, and
Yes.
yeah.
So I'm thinking we may not even have to pay nurses, because like where we work, Jose, people volunteer,
Right.
volunteer because they get like clinical ladder, or they get, a good evaluation just from volunteering. So it's possible we could do that instead of actually paying people.
Right. But I guess I'm wondering if we have to be as specific as like paying for a tent rental, or
Yeah.
the cost of whatever informative brochure
Yeah,
is going to be,
pamphlets.
So I think we could all work on that and just kind of, again, trying to keep it as highly informative but succinct as possible, and then we can, I guess, add stuff in our. I think this one could be an everybody kind of editing
Yeah.
and inputting. But does everybody like that health fair idea?
I think that's a great idea.
I think it's a really good idea.
A lot. Okay. Yeah, let's go on to the next one. I'm trying to keep in mind coming up on Christy's appointment time.
Yeah.
All right. Slide 10, describe how you would measure learning outcomes. This is for us, it's going to be a questionnaire, right? And
Yeah.
that kind of stuff.
It'll have to be, a questionnaire, and essentially self-reported, because I don't know if
Right.
we have any other way to document if they quit smoking or cut down or.
Right. In the article that I have this week, there's actually a way apparently to determine if you've been smoking through some sort of chemical testing of some sort. So, I mean, that's something that I'll share that with you, or you guys can see it on the article. But
is it is it cotinine testing?
It starts with a C, and I think it is.
Is that expensive?
You know what? I do not know. Some things that I can actually look into, if you like. Let me do that. Is at least research that, and of course, this is for slide 10, right?
Mm-hmm.
Yeah. Research the chemical testing aspect, right?
Yep.
Instead of course, we can always do self-testing, but as we all know, sometimes that's a little bit, kind of like telling us what we want to hear. Yeah. Like, oh no, I haven't smoked in like years, and we just stopped yesterday. So anyways, so again, this is one that of course we can all kind of input on this guy. And then describe how we can then evaluate the project, which is slide 11. Of course, smoking cessation is the goal of the intervention, IE project, right? So again, this kind of leads back what we were just talking about, is maybe the testing, the self-reporting. I guess you can even go as far as like physical assessments of patients, maybe like if their blood pressures come down, or they're able to, I don't know. We can go back to what Chrissy was talking about, and look, they've lost 20 pounds, or they're able to do a half marathon since we last spoke, because they're implementing their physical activity aspect of it.
Mm-hmm.
Right?
Yep.
Yeah.
I'm just reading the slide.
You need to ensure that all the components working through the duration. So this is to ensure that all the components of the project are working through the duration. So what I like about that is that the last A of our 5 A's is where you're kind of following up and kind of trying to make sure that these guys are kind of doing what they're supposed to be doing, right?
Right, and it says more to come in week 6. I wonder, should we hold off on this particular slide until we know a little bit more?
Sure.
Yeah. So why don't we fill in, let's complete what we have now. And
Okay.
then if we need to regroup, if we need to reorganize, if we, need to put different things on different slides, at least we have like a stopping point
Right.
that we can
Or you
do.
say let's kind of stop at 1 through 10 or whatever, and then
Right.
kind of getting, not, again, just like exactly what I had said, let's not determine everything right now. I think that's a good idea, Christy, is just kind of, thank you, because I would have just gone on to the end of time. I said, don't hesitate, tell me to be quiet. No, I like that. That way, instead of trying to kind of take it all in and trying to determine everything now, I like that.
Okay.
Yeah. So I feel that we should probably meet a couple times here in the next week and a half or so. I don't know like how you guys feel about that. I know that we probably will have to anyways, just because of the trying to get our presentation recorded and coordinated. Like
Right.
I said, if you guys want to meet again this week or early next week, and then again, whatever you guys want to do, what do you guys feel like we should do?
Let me grab my schedule real quick.
Sure.
This works good for me just because at home it's so chaotic at home. So, I mean, if you guys can do this time, and usually I don't have a meeting on Thursday, but just happened that it fell on this week.
Yeah. So you like this time? It kind of has worked out for you a little bit, huh?
What's that?
You like this time? The time frame is work out for you better?
Yeah.
Okay. And that actually for me too, because I find that I find with me in particular, the earlier, like when I have like dentist appointments or something like that, the earlier I schedule, the better, because then I'm not like trying to like think about it all day, and then something comes up and they're like, oh man. So I also like this time better. I don't know about you, Michelle. We were just discussing the time frame. Kristen's saying that this time frame works for her a lot better because she feels like she can kind of doing it
I really have
doing it
3
there
weeks
for her.
left.
It depends on the day that it is.
Okay.
So like, are you guys thinking like this Saturday also, or what day are you guys thinking?
I'm up for whatever. I am freed up Saturday, but I don't know what you have going on, Christy.
Christy's got lots of stuff, so.
Yeah. So for me, I'd rather cater to kind of like at least consider your stuff more, because Michelle and I don't have this other big looming thing above your head. So let's kind of whatever you feel like you can do. I'm good to go.
Yeah, how about are you guys off on, only because on the weekend I'm so busy with either football or gymnastics.
Right.
How about Monday? We could do like Monday and Thursday, Monday, Wednesday, Monday, Friday.
I'm open Monday, Thursday. I'm open. I'm actually only working next Tuesday, Wednesday. I took an extra day off, so whatever you guys want to do besides Tuesday, Wednesday.
How about you, Michelle?
I work on Monday, and then Thursday I am open. It would have to be like 1 o'clock or later, though.
That Thursday at 1 o'clock is fine for one of the meetings if everybody else is okay with that.
Yeah.
And then, so that is the 15th.
Got it.
And then you said that you work on Tuesday, Jose?
I do. I work Tuesday. I work Tuesday, Wednesday, and that's it. I'm off the rest. Wait a minute. Yeah, I'm off the rest of the week. So whatever you guys want to do. You guys want to do, well, we'll have to do maybe Saturday or Friday, because we have to schedule our recording, right? Because it's due Sunday, the 18th.
That's right.
Yeah. So, a huevo, we're going to have to do something somewhere there.
What
I
time?
almost feel like it has to be Saturday or Friday.
What time can you guys meet this Saturday?
This Saturday I can do like early evening or in the evening.
I can meet at 5 in the morning or midnight. I'm
No
totally
way.
open. I'm barely getting home from partying, so I don't know. Whatever. I'm open all day. I mean, if you're willing, I know, Chrissy, whatever, I know you have the family commitment, so if you're willing to do whatever time, I will clean the damn slate.
You
Or
guys tell me
whatever.
what time Saturday. Mine is more in the morning, so I mean, if we were to do later, like Michelle, maybe a 6 o'clock.
Yeah, that would be good for me.
Okay. Done.
So that's going to be the 10th.
Yes.
Yep. So the 10th at 6 o'clock, we're going to meet. Thursday we'll meet at 1 o'clock,
Yep.
right?
Yes.
And then we will, I guess we will have to determine a recording session date, right? It has to be either sometime after the Thursday meeting, I feel like, because I don't think we're going to be able to just come together on Thursday and hook it up and be all good to go.
Okay.
I'm starting to feel it. I'm starting to feel it, man.
All right.
All right. So we'll see. We'll keep communicating with each other from here on out, of course, and then we will come together on Thursday just to kind of follow up on whatever next week's stuff is, and hopefully we can get some of this 1 through 10 pretty much knocked out by then.
Yes, and then we'll see you on Saturday, and we'll see where we are and touch base again.
Yep.
All right, guys.
All right, guys.
Great. Thanks,
See
guys.
you soon.
Bye, guys.
Bye.
Bye.